it's Mary Brownlee, licensed professional counselor and trauma therapist. Today we're going to talk about the topic of post-traumatic stress disorder and pregnancy loss. This is more common than people realize, and I myself am a survivor of multiple pregnancy losses, and so I thought I would lend my personal experiences and my professional experiences to really talk about healing from this incredibly devastating experience that so many women go through. A lot of us feel alone when we go through something like this. There's not enough support for this unique trauma exposure, and there's a lot of shame and a lot of self-blame that goes along with this particular loss. So we will be talking about the statistics about pregnancy loss, normalizing just how common, unfortunately, this is, but also we're going to talk about healing. And I want to leave you with not only my personal story of overcoming this particular loss, but a little bit of hope that you too can overcome this devastating, traumatic experience and go on to have purpose and meaning and find happiness in your life. So without further ado, let's get started. All right, let's go ahead and talk about some of the statistics around pregnancy loss. About 10 to 20%, if not more, because not all pregnancy losses are recorded. 10 to 20% of all pregnancies result in miscarriage before reaching the age of 28 weeks of gestation. That is a huge number of women. That means approximately 2 out of every 10 women, if not more, have suffered a miscarriage in their lifetime. So there is a lot of us out there carrying this unique loss. Additionally, there are about 2 million stillbirths occurring yearly after the 28-week mark. So pregnancy that essentially is lost after 28 weeks is termed a stillbirth. So 2 million of those happen annually. So there is a lot of devastating trauma happening to women that nobody really talks about, right? And so that is another thing we'll be talking about here as well. Okay, the next type of pregnancy loss is an ectopic pregnancy. I myself had 4 of these, and all in a row. They are always fatal if left untreated because essentially the baby has grown outside the uterus. Usually it's in the fallopian tubes. Sometimes it can be not in the tubes and just out in the abdomen. But they're always fatal because the woman essentially internally bleeds and is fatal unless medical intervention is appropriately delivered and timely. So about 1 in 50 pregnancies are ectopic. So a lot of women are having these kind of very immediately life-threatening pregnancies. And 10% of all pregnancy-related deaths are from the blood loss from these ectopic pregnancies. And ectopic pregnancies are the leading cause of first trimester deaths. So before the age of 12 weeks, if a mother dies during the pregnancy, it is pretty much, it's an ectopic pregnancy. So they're the leading cause of early maternal death, again, from that internal bleeding, which I did unfortunately have. So my ectopic pregnancies directly resulted in me getting PTSD years ago, but I also had childhood trauma. So the two intersected to form a very, very nasty mixture. So I'll talk about that in the coming slides, as well as how trauma has a layering effect. So whatever trauma you had earlier in your life as well before you got pregnant and lost your pregnancy can also contribute to your likelihood of getting PTSD. So we'll talk about that in just a minute. One of the things that was really important for me as a trauma survivor with this type of loss was the knowledge that I wasn't alone, and that to normalize this type of loss. So many of us have nobody to talk to when it comes to pregnancy loss, and that just completely skyrockets the likelihood of getting PTSD if we don't have anyone to talk to and receive support from. So I like to try to at least normalize that this is something that happens to so many of us, and that you're not alone, and that it wasn't your fault. So 25 to 29%, about 30% of all women experience PTSD 1 month. So PTSD happens if the symptoms of PTSD are occurring for at least 4 weeks. So the woman will have her pregnancy loss, and then PTSD symptoms will start and continue without ending for at least 1 month. And that's when you know you have PTSD on board. And so, yeah, up to about 30% of women have PTSD after a pregnancy loss, and 18% of them still meet the criteria up to 9 months after the pregnancy loss. So this is a very serious impact on women's mental health. And again, there are not enough supports out there directly related to this loss, which is very disappointing to me as a woman, and especially in today's modern world. There should be more supports, since this is something that is actually very, very common and very traumatic, and highly, highly increases the likelihood of PTSD and negative mental health outcomes in women. So again, that is why I am taking time to address this very important topic today. So what are some common symptoms of PTSD? For sure, my first clue that something had gone terribly wrong was it was the second ectopic pregnancy, and I had emergency surgery because I was bleeding internally. And I woke up from the surgery and I immediately started crying because I could not believe I had survived. I thought I would die, essentially. So I remember my last thoughts before I went into the surgery was, this is it. I'm never going to see my daughter again. I'm going to die. So that is a key thing. I've heard a lot of people with PTSD specific, to threaten death, where you actually could die, or witnessing somebody dying, is this thought related to, this is it. Like, my life is never going to be the same again, or I'm going to die. So I can actually remember that. And so when I woke up from the surgery, I kind of gasped, and my first thought was, my God, I can't believe I'm alive. And then I started sobbing. So it wasn't until about 24 hours after the surgery that I had my first panic attack. I'd never had panic attacks before then. And I thought I was dying because I was having the symptoms of essentially a heart attack. Like, my chest was hurting. It was hard to breathe. My vision was narrowing. It was really terrifying. So off I went to the emergency room thinking I was dying of a heart attack, only to find out, you're having panic attacks. And thankfully, the doctors there were very kind. The one that treated me had colleagues actually that had PTSD and trauma. So that was my first clue that my life would be forever changed, not only just from the loss, but my brain had a breaking point. So we'll talk about that a little bit more. But first, I wanted to go through some of the symptoms. So anger and irritability, very common with PTSD. So your nervous system has gone through so much distressing events that have been overwhelming, and clearly we're outside the norm. And oftentimes they overwhelm our ability to cope as well, because they're so outside the norm. And so our system goes into a state of fight or flight, essentially trying to keep us safe and trying to help us survive. And so anger and irritability is a sign that the nervous system is chronically overstressed. So that is very common with PTSD. Loss of faith in a higher power or in meaning and purpose in life. Very, very common with trauma. I remember being angry at God for a large period of time. I lost my faith for a large period of time. My sense of spirituality and what happens after we die was altered. So this is common with people with PTSD as well, that whole sense of purpose and meaning and why we're even on this planet, that gets altered. Avoidance of reminders. Oh my goodness, yes. So women with PTSD in this area, like going to the doctor, brings on panic attacks. God forbid you have to go to the hospital again. Holy cow. You talk about flashbacks and panic attacks and anxiety symptoms through the roof. So we will attempt to avoid any and all reminders of the event because it is so highly distressing to the nervous system. An altered desire for sex and intimacy with our partner or our spouse. Very, very common. Sex is no longer, this is, I think, that the saddest thing about this particular trauma, one of the saddest things at least, is that your relationship with your romantic partner is completely changed. And sex, the meaning of sex and intimacy is completely changed, because for most people, sex is a way to connect to their partner, and it's fun and it's fulfilling and it adds a lot to their lives. But for those of us who have suffered this devastating type of pregnancy loss and possibly even died as a result, almost died, as a result of being pregnant, oh no, sex takes on a completely new meaning that is extremely traumatic and is tinged with loss. And we also have feelings of like, our body has betrayed us as well. So you mix that in there as well. And no longer is sex this fun, like, whoa, let's just go have some special snuggle time. Yeah, no. It takes on a totally different meaning. And so that's a struggle commonly for women who have suffered pregnancy losses, is changes in their intimacy with their spouse or their partner too. Panic attacks. Oh my goodness, yes. Oh, yes. Very, very common, where women will have high degree of anxiety, high degree of depression, and also commonly will have panic attacks as well. Nightmares. Oh yes, that comes with the territory. Intrusive thoughts or memories related to the loss. So yeah, these intrusive thoughts come in as like, they just come in as thoughts that you don't want. You don't want them there. And then here they are, just repeating ad nauseum in your head. And you wish you could get rid of them, but oh no, your brain's going to replay. So that's part of what trauma does. The brain is trying to help you stay safe and figure out how to stay safe. And part of the reason it's replaying memories is it's searching for a way to find safety again. So that is very, very common with trauma survivors. Hypervigilance. Oh yes, constantly feeling on edge. Very common. Shame. Oh, so much shame, right? We women who have these types of losses, again, it's not really talked about in our society, which is, again, kind of shocking because it's so common. So many women keep silent about their losses, and we feel like we can't tell anybody, we can't talk about it. So it's like this unique trauma where there's this sense of, I have to stay silent and not burden other people with this type of trauma, especially like a lot of women who are happy mothers and have plenty of kids. That can isolate mothers with this type of loss, where it's hard for them to relate maybe to their friends or their sisters or their aunts, their female family members who have kids. So it's a very isolating experience as well. Feeling numb. Very common. Numbness, disassociation, kind of emotionally checking out, very common. Feeling very distant and detached from other people, very, very common. One of my clues that I was needing to get help actually was this inability to feel my emotions, like they had just turned off. Like I had my daughter at the time, thank goodness I had my daughter. She was my little anchor. It kept me on this planet for a while. But I had my daughter, she was about, I would say 2 to 3 when this emergency surgery happened. And she was the light of my life. And so after we had her, we started trying for more kids when she was about 2. And that's when the ectopic pregnancy started. And what happened was I stopped being able to feel love for her. And she had been the absolute love of my life. So that's when I knew something is terribly, terribly, terribly broken. And then this adds the additional burden of shame. Like, what is wrong with me? I can't even love my loved ones anymore. I'm a monster, right? So women and PTSD survivors turn inward and blame themselves even more. Like, I am horribly broken and I'm a monster because I can't even feel feelings anymore. So that is something that's very scary to them. And I always touch upon this, and there's so much relief when my clients with PTSD have these particular symptoms. And I just reassure them, hey, this is trauma. This is not you. You're not a terrible person. This is what trauma does to people. So we're normalizing the symptoms, and that you're not a terrible person for having PTSD. It has not changed who you fundamentally are as a moral, ethical person. This is just mental health symptoms, and that's what PTSD does. It breaks the brain for a little bit, but it doesn't mean you can't heal. Thoughts of death or intense fear of death. So yeah, a lot of people will have this kind of very intrusive, like, it's hard for them to stop thinking about death. or a horrific fear of death too, like phobia type of fear of death or bad things happening. I've had mothers report that they got even completely phobic around their existing living children too, like terrified to let them out of their sight lest something bad would happen to them. So yeah, this altered sense of terror around death can happen as well. Reliving the memories and emotions of the loss over and over. So again, yes, those intrusive memories and feelings will sweep over us in the form of like emotional flashbacks or even memories of what happened, or just intrusive negative thoughts that are altered in how we think about ourselves. But yes, the whole idea is that these thoughts and feelings are very, very intrusive. We don't want them there, and they happen repeatedly. So these just kind of give you a general idea of what it feels like to have PTSD from the inside. So I hope this was helpful. Okay, so some additional things that I have seen in my clients with this type of trauma, as well as myself, that can contribute to a higher likelihood of having PTSD are several things here. Commonly, I will see additional trauma prior to the pregnancy losses. So maybe they grew up with lots and lots of childhood abuse and neglect. So if somebody comes in with complex PTSD or is at risk for complex PTSD because they've had, again, those layers of negative experiences with loved ones before having pregnancy losses, that's going to make you at a much higher risk for PTSD. So trauma, we know, it has a layering effect. Every person has a unique nervous system based on their biology and their environment. And the more layers you get in there of negative, overwhelming, traumatic experiences, the higher likelihood of PTSD. Like our nervous system can only take so much before, oof, it's like a straw that breaks the camel's back moment that floods the nervous system and can cause PTSD. So that's going to make it a much higher likelihood. Not having a healthy support system. So this goes hand in hand with people having unhealthy family dynamics, as oftentimes they don't have strong, loving support systems. And what I find fascinating, some of the research, so Dr. Bessel van der Kolk is probably one of the biggest experts in the trauma field. He has shared some of the research around those who get PTSD versus those that don't. And in a nutshell, what the research has shown, whether it's combat veterans or those surviving 9/11 or like Hurricane Katrina, for example, is that those who had loved ones that they could go and grieve and cry and receive emotional support from very quickly after something traumatic happened. Like trauma's normal, right? You'll have normal traumatic responses after something bad happens, but the point is that it will resolve and go back down after a period of time with the right social and emotional supports. It will go back down actually on its own. A human body is pretty resilient. But what happens in those that get PTSD is that oftentimes we don't have those loving, safe, nurturing social supports to grieve and cry with. And we're very isolated and we don't have a strong social support. So we keep all of our feelings and our trauma to ourselves and we can't talk about it and grieve and cry and move through those grief stages. So boom, trauma gets locked in the system. So that is the biggest difference between those who go on to get PTSD and those who do not, is the social and emotional supports. Are they healthy? Are they there for you? Or no, you're very, very isolated. The more isolated you are and the less loving, safe people you have to overcome trauma with, the much higher likelihood of having PTSD. And then the third factor I've seen, unfortunately, so incredibly common, especially with women and in the healthcare system, is a lot of medical professionals adding additional layers of trauma that did not need to be there. Maybe it was through comments or lack of action that resulted in poor health outcomes, the way that they were physically handled during labor and delivery of, say, a stillbirth or a miscarriage. But yeah, really like poor bedside manner. Doctors who were not trauma informed and were extremely cold and not compassionate, and that added a whole other layer of medical trauma that did not need to be there. So I've seen all of these factors, unfortunately, way too often in my clients and in myself as a factor contributing to our PTSD. All right, the next slide I want to talk about is healing after pregnancy losses. So I think bigger picture here is we want to take the stigma and the shame out of pregnancy loss. As we've already gone over, it's way more common than I think most people realize, sadly. And also, the biggest indicator of whether you will go on to heal after something terrible happening like this is your emotional and social supports. So if you have safe, loving people to grieve and cry with, you will move through trauma naturally and it will subside. So every person, regardless of what trauma they've gone through, trauma has a natural like bell curve where you'll see the trauma symptoms go up and they'll be at their highest, right, after a period of time. But naturally, it will go back down again with the right social and emotional supports. So that's what this slide is really going to address. The grief stages here, completely normal. A lot of healing from trauma is actually grief work, and grief work that's unresolved. So it's very important that not only do we get ourselves some safe, healthy, loving, kind social supports, a good trauma therapist is incredibly helpful, somebody who's trained in this area, but things like support groups or friends that understand this type of loss, all of this can be really, really helpful. But you want to be able to move through those grief stages with loving, kind, safe people because your emotions are going to be all over the place. Let's just normalize that. There's going to be lots of just feeling numb in the beginning. It's not going to feel real to you. You'll move through anger and again, being angry at God, being angry at the world, being angry at family members, totally normal after trauma. Bargaining. So that's like the what if. Oh my gosh, we do the horrible what if game of what if I had done this? Maybe I wouldn't have lost the baby if I had done this. Horrible what if game. Yeah, don't play that with yourself. There's nothing you could have done differently to change the outcome. Let me tell you that right now. There's nothing you could have done. You did the best you could. Self-forgiveness here and compassion for yourself. You did not cause this pregnancy to end. It is not your fault. This just happens. And sometimes we don't have any answers for why it happens, and it's not your fault. Depression, very, very common. So this is now where we've gone into the stage of like recognizing it happened and it hits us like a sledgehammer and we lose all hope and just the deep grieving and sadness and crying happens. And again, all these stages are not linear. They're kind of messy. They can be all over the place and they all have their own unique timeline. So no stage of grief can be pushed through really, really fast. So some of my clients are like, chop, chop, can I just get over this PTSD in like a few months? If only it were that easy. Grief has its own unique timeline. And for many of us, it takes years to completely resolve the symptoms of PTSD and grief from these type of losses, especially if you have layers of loss. And then after all of these stages are just left to just be experienced in this safe way with these safe, loving supports, what you'll find is you'll move into the final stage is acceptance. And what that really looks like is a recognition of everything that you've lost. It no longer is super emotionally dysregulating anymore. Like you can think about the loss and go, yep, that happened. I remember all that. But it's not like it's hitting you with very, very dysregulating memories and emotions and thoughts all the time. Instead, it's just more of this quiet, like, yep, that happened. But now you have a newfound sense of safety and a new sense of maybe purpose and meaning. And you have compassion for yourself and you're not blaming yourself anymore. That's really what acceptance looks like. It's this beautiful, compassionate place of rest where you're able to realize that you did the best you could, you've grieved the loss, and you're ready to move forward. So all of us will get to that stage of acceptance eventually, but it can't be rushed. It can't be rushed. Every stage is this beautiful, stage of healing trauma that just needs to happen. It just needs to happen. And so if we try to circumvent any of the stages of grief, no. That's why PTSD is there in the first place, because we did not have the right healthy supports to be able to do this grief work successfully. It is going to be messy and it's going to be painful, but it's all okay in the end. It will subside. I'm here to tell you I had four of them. It will subside. You have to have enough safety for enough period of time, though, for it to subside. For example, like the 4 ectopics, right? One right after the other, that wasn't safety. So my PTSD just ratcheted it up with each layer. You got to have no more layers. So for PTSD to go away, no more layers. If you continue to have layers of trauma, it's going to be very hard to get rid of it. So this is why it's important to stop having pregnancy losses or stop having any further trauma exposures, for the body to go and come out of fight or flight and realize, okay, I'm safe again. And that takes some time. All right, my final thoughts that I want to leave you with. You are stronger than you think. Yes, you are. Yes, you are. Every person who survives trauma is so amazingly resilient and strong. We don't feel that way. We often feel like a failure and that we're weak. No, you're not weak. Every human person only has a certain point they can take of horrible things happening before the nervous system breaks. This is not your fault. So let's dispel that myth right away. It's okay to not be okay. That's right. How do people expect us to feel after horrible things like this happen and repeatedly? You're not okay. It's okay to not be okay. You'll be okay eventually, but it's okay to not be okay right now. You're not alone. So many of us go through this. Yeah, we do. It's not fair. It's not right, but it happens. It wasn't your fault. Nope. A lot of times those of us struggle with the why. Like, I have to know the why. Why did this happen? Oftentimes with trauma, we'll never have a really good why. That's part of the healing process. You got to be okay with not having a why sometimes. Life is fundamentally massively unfair for so many people. And sometimes there really isn't a really great why. Healing has its own timeline. That's kind of what I mentioned in the prior slide. It happens when it happens. And with the right supports, I can assure you it will go back down and you will heal. But it has its own timeline. It can't be rushed. And finding a new normal is the last little bit that I want to leave you with, because some people wonder, well, will I ever go back to being like I was before? Nope, you will not. So it's not about going back to who you were. It's about finding a new normal, because trauma fundamentally changes the nervous system and the brain pretty much forever. Doesn't mean you can't heal and find, a new sense of acceptance and peace and happiness and all of that. But that's a journey, and it is a new normal. You'll never be who you were before the trauma happened. You can still be amazing and happy and fulfilled after trauma, but it is a journey. But you're not the same person. You're never the same person again. The analogy I like to give is like a scar, like my C-section with my daughter, right? My body's never the same after I gave birth. Nope. I have that scar. It's a permanent part of me. And very much PTSD is like the same way. It does leave a scar, sometimes in the legacy of like maybe a heightened startle response that we have, but that's kind of mine. So, it's been like 15 years later. I still have a heightened startle response. I still have nightmares, not about the pregnancy loss per se, but related to the complex trauma that I had. So nightmares and a heightened startle response are pretty much the legacy, but the rest completely better. Like, I don't hate myself. I don't blame myself. I feel safe again in life. I have a new sense of purpose and meaning that is fulfilling. I have deeply loving and fulfilling relationships with my friends and my family members. And I feel fulfilled as a person. So yes, you can have that too. You can have that too. All right. So that's the new normal. I can look back on my trauma and remember what happened. But again, it doesn't emotionally flood me anymore. It's just like, yep, that happened. So I hope that this has given you some hope. If you've had these experiences, I hope that this is something that brought a little bit of healing to you today, just to normalize this and talk about it and give voice probably to a lot of the things that you have been experiencing. If you have any questions, feel free to drop them below. And again, feel free to leave a like or subscribe. That helps support my channel. But ultimately, my heart is with any women who have lost babies and children. My heart goes out to you. I know exactly what that feels like, and I'm here for you, and I wish you a beautiful journey of healing, because I know that's possible, and you can do it, and you deserve it. Take care, everybody. See you in the next video.